do this. So let's get going. So welcome. This is a webinar from ThankStock, and ThankStock is basically we work in two ways. I'm sorry, we might actually. Yeah, okay. We work in two ways. So what we're going to cover today, so a little bit about us, how we work. We're going to talk about a little bit about our first cohort of the doctors that have joined our private clinic membership. So it's really exciting. We've got Dr. Sonia Malik, who's joined us, and she started a ADHD assessment and diagnosis clinic, which is doing really, really well. So she's here to give some helpful hints and just to educate us a little bit about ADHD. You can ask questions throughout. You can try to ask them in the questions box. I can't see the questions as they come up, but I'll have a look after I sort of minimize my screen. So at the moment, I can only see my screen. I can't see you guys. Just let you know that this is being recorded, so keep your cameras off if you don't want to be seen by people on YouTube and in general. Okay, so let's get started. Okay, so who are we? So we are the only digital and physical doctor on-demand service in the UK. What do we do? So we work in two ways. We have our private clinic membership, where we help doctors such as yourself open up their private clinic under our CQC and infrastructure. And we also have the Uber for Doctors model, which is basically a business-to-business doctor on-demand service. So the way you book your Uber is the way you book your doctor, and that happens on our platform. But what do we really do? We want to empower GP to work flexibly, to be valued, to be well paid, and to avoid burnout. And so we're giving them this opportunity to do what they do best, treat patients how they want to do on their terms. So a little bit about me. So I wear many hats, and I've worn many hats over the years. So I qualified as a GP in 2017. And after I qualified as a GP supervisor, I opened my own skin clinic in Harley Street in London, where I specialize in treating skin of color. I also done clinic consultancy, so I helped other businesses open their own aesthetic or medical clinics. I've dabbled in properties. I've also launched courses, so CBT courses, so I'll teach people about dermatology and specifically in skin of color. I had my own professional cosmetic line, so chemical peels, and also just normal over-the-counter skincare. And I believe in trying everything. My mantra is fail fast and fail forward, because it's the only way you will learn. And that's why actually we've given you this sort of like this hand holding in opening your own private clinics, because it's the way that you're testing. It's basically your proof of concept, because we don't want you to spend loads and loads and loads of cash trying to open your own private clinic and actually it doesn't work, and then you try to pivot to try and do different things. So this is almost your safety net to do what you've always hoped to do and always wish to do. So this is a few of my sort of like mood board snapshot through my life in terms of my medical career. And you can see there in the bottom left-hand corner, that was me teaching a group of my nurses and pharmacists, and I think there was some beauty therapists, and how to treat skin of color. So on my CPD course, I've done a lot of exhibitions, and I love dancing. I love doing bachata, which is, I think it originates from Dominica, but it's sort of like a Latin dance, similar to salsa, but slower. So I love dancing. So that's all about me. I live in London. I've been a locum GP ever since I qualified. I think I done one stint of salaried in urgent care centre, and that lasted about 6 months. So I'm definitely, I love locum life. So how do we work in with ThankStock? So we have the Uber for Doctors model and a private clinic model. So you can do one option or both options. So Uber for Doctors model, you just sign up to a platform and you basically get pinged jobs similar to Uber. So the jobs can be anything from a 15-minute sort of online consultation to a 3-hour private menopause clinic at your local pharmacy. In terms of our private clinic model, you can launch your own private clinic under our CQC umbrella, and you can get up and running in a week, and we would just handhold you the whole way through. Whatever you don't have, we will signpost you in the direction, because we've worked with lots of providers over the years. So whether you want your website done, we've really got a good package of websites, so you can get a website up and running within a week for I think £500, and that's with our partner web developers. So there's lots and lots that you can get into, and we just want to make it really easy for you to just do what you want to do and work on your terms. So in terms of Uber for Doctors, we partner with a lot of companies, particularly companies that are cash rich and time poor, like law firms. Lawyers want everything done yesterday. They're really, really impatient because they work really long hours. So when they're sort of down with a cold, they want it just sorted very quickly. They don't want to go to the NHS GP and spend, I don't know, three weeks on the waiting list to see a GP. By then they're either better or they're dead or they're in A&E or something. So they just want things sorted quickly. So actually, a lot of partners have been reaching out to us to join our platform so they can reach you guys that will provide these services. So the services you can offer are in-person consultations, referrals, so anything you'll do on the NHS, you can basically do it privately. But other things like which you may not offer via the NHS, like hay fever injections, travel vaccination, earwax removal, the services that have been decommissioned, you can also offer privately. So private clinics, how do we work? So you come under us, under our CQC, and we have the medical indemnity insurance. So it's actually £29. We say it's the same from, and then we're going to sort of scale it up, but it's £29 for everything. And I'll show you actually what it covers, because it covers both medical services, but also aesthetic services. So you can basically do what you want within reason. We offer you clinic support. So it's actually a very structured 4-week support program that you go through with your cohort, just to get up and running, and to make sure that you have everything in place and all your questions are answered, and you basically just know what you're doing by the end of that 4 weeks, and you're good to go. We also provide the medical records software, because those actually can be quite expensive when you sort of just go to these providers. So sometimes it can cost up to £100 plus per month for electronic medical records. So we include that. We include electronic prescribing, consent forms, and lots of bits and bobs. We also work with referral partners. So we actually got the sort of the partnerships with radiology companies, and also laboratories, hospital consultants, if we need to refer the patients further on. Okay, so things we cover, it's a bit small here, but I hope you can see, and I hope it projects okay. But all the GP and primary care services, so that's everything sort of sexual health screening, minor injuries, mental health consultations, sick notes, medical certificates. We also do asynchronous weight loss management, but that's with clauses. So you have to make sure that you see the patient at least once for a review. But we can do asynchronous. And asynchronous basically means not in sync. So that is like when the patient fills out a form, and you at a later time will then review the form and prescribe the medication. So we do like minor procedures as well, cryotherapy, joint injections, skin biopsies. We cover for lots of things. So medical services, and you can see here at the bottom, aesthetic or cosmetic services. So Botox, fillers, Profhilo. So anyone who's into aesthetics will be familiar with these types of treatments. Hair treatments, so like PRP, scalp microneedling, etc. What things do we not cover? Oh, those are other bits and bobs that we cover. So you things like laser hair removal, IV vitamin drips, general aesthetics, everything, all these sort of specialist clinics. So things that we don't cover, we'll say we're not able to cover obstetric deliveries, but you wouldn't really be doing that anyway as a GP. Anything in high risk, like cosmetic surgery, they have liposuction hair, and actually it's good to include or exclude this, because there are some clinics that offer liposuction under local anesthetic. I know I've seen it and it looks a bit hairy. I don't really want to dabble, but we can't do things like that. So basically nothing that you wouldn't do in the scope of a general practitioner. We don't do hair transplant, so where you take the hair follicle from one area or from a donor and then transplant it into another area. We don't do things like that. And we wouldn't just do purely asynchronous. We need to see the patient at least once just to make sure that they're there and they're a real patient. So we wouldn't do just purely asynchronous weight loss management or any consultation. So we have to have a video consultation somewhere through that patient journey. If you have any questions, just put them in the box below. Just wondering what time or just remember it, because I'll be probably finishing in the next 10 minutes, and then you can sort of shout out. Yes. So why are we doing this? Many reasons. And I guess with the GPs, you know what's happening in general practice, and a lot of us are being burnt out. A lot of us are unemployed or underemployed. Lots of people are looking for work and taking the pay is not going up, inflation is going up, so cost of living is going up. So the pay is basically in real terms declining. And so it says a third of GPs plan to quit patient care in the next 5 years. And that's not because GPs don't like doing patient care. I actually really enjoy seeing patients, but I just don't like the circumstance that I see them under. So the 10-minute sort of time pressures. So, I mean, what are you going to really do with a patient in 10 minutes, especially now? People are living longer, people are more complex. You've got all of the other healthcare professionals in general practice seeing the more simple patients, and therefore the GPs are getting bombarded with the very, very complex patients with no sort of breathing room of the simple UTI that will just allow those catch-up slots. So that's why a third of GPs are planning to quit general practice in the next 5 years if things don't change. I'm going to go through these quickly, but just so you know, so I work with a lot of pharmacy partners, so I have sort of my ear to the ground of what's happening in the land of pharmacy. So we know that actually by next year, all the pharmacists coming through, as in graduating and qualifying, will have the prescribing rights. So that's actually a new thing. Before, it would be that individual pharmacists can, opt to go on a course and do it. So, and many pharmacists didn't do that, but actually going through. Now qualifying for 2026, they'll all have the right and the ability to prescribe. So they'll be similar to the GPs in terms of some of the services they're offering and where they can work. Thousands of people are struggling to find work, which is what we spoke about, and GPs are working for free just to keep up their sort of rights to be on the performers list. Here, rising patients per GP in England. You can see that actually, I think before it was meant to be on average 1,800 patients, and now it's about 2,500 patients per GP. And I read somewhere, I can't remember, was it Pulse, that actually there's on average two GP surgeries closing per week, which basically means patients are having to travel further to see a GP, and all the surrounding GPs are absorbing the patient, and that is just increasing their workload. So we can see that it's not really sustainable. This is like a graph about GP pay. This is all going to be recorded and put on YouTube, so you can have a look. I'm just going to whiz through this very quickly. Lots of UK patients are going private, and I think you yourself have seen patients that come with a private referral or come asking for private referrals, whether it's for scans, whether it's for a secondary care, whether it's for lots of different things, and even things that are no longer commissioned on the NHS. So our private clinic platform. So what? Yeah. So we've gone through this slide. So we can get your website is meant to be website in a week, not clinic in a week. So we can get your website up and running. And with that, we integrate WhatsApp. WhatsApp is so important I keep like harping on about it and singing about it because it's so important for communication, especially with patients. Is it 2 billion people worldwide are on WhatsApp? And actually, sometimes with patient care is the person that answers first. So with our WhatsApp, yes, we have like an automatic like message, and it's all very, very slick. But actually, the person that answers first and gives the patient that information is usually the person that wins that patient. So nobody wants to email and wait for an email or call and you don't pick up. People just WhatsApp, and then there's always someone there, or the sort of automatic sort of chatbot or AI assistant that helps you answer. So you will get your the plain WhatsApp, and then you can sort of upgrade if you want anything else. Then you've got your paid patient booking platform. So it's a free platform, but then you make sure that you get patients booking in and paying as they're booking in. Consent forms, SEO, like sort of a minor SEO. So this one that will just get you going, so not sort of full-blown SEO. So if you want to get your website up and running in a week, then you can go to demosites.thanksdot.co.uk, and then you can see the packages and what we offer. Okay, and these are just some examples of websites, and you can obviously customize everything and have your own pictures, etc. Okay, so things you can do under RCQC. So you can do online consultations, in-person consultations, home visits. You can work from anywhere in England or see patients from anywhere in England. You can see any age from 0 to 100. You can do any GP-related clinics, so or services that are in the scope of a GP, which is basically a lot of things. And you can do also aesthetics, including IV trips. There's things you can't do under our CQC. So I've always had to prescribe dodgy or risky drugs because there's so many of us. There'll be at one point 5,000. So there's 5,000 on the wait list. We're kind of onboarding people slowly and in a controlled manner. But because there's so many of us, we have to make sure that we have sort of clinical governance over everybody. So we don't allow any prescribing of Schedule 1 to 5 drugs, Class A, B, or C drugs. the Z drugs, the high risk drugs, so like the benzos, the barbiturates, the gabapentinoids, none of that can be prescribed on our platform. We will slowly, once we've got everything under control, we'll slowly add on other medications. But right now, whilst we're still quite new, we just want to make sure that we're safe and we can have oversight of what everybody's prescribing. We can't see people, we can only see people in England, so patients in Scotland, Ireland, Wales, or anywhere else we're not able to see. And there's only GP on our platforms. We can't do secondary care type services. And all medications have to be dispensed by regulated pharmacies. It's really strange that I have to put this in because some people actually dispense, they've been on the news. I think some of the aesthetic clinicians have been prescribing Botox, but they're getting it from like Korea, and people are turning up with like botulinism. So I think actually you always, and all of our partner pharmacies are regulated. In order to onboard, we have to check their GPHC like registration and everything. So we always have to make sure that all medications are dispensed by regulated pharmacies, and we have a really great pharmacy partner called Quincy Health that everyone will be onboarding with and able to prescribe. And the medication is sent to the patient. The prescription is sent to the patient, and they can go to any pharmacy in the UK to get that dispensed. Otherwise, it can be sent to the medication itself can be sent to their home. So, yes, I'm not going to sort of talk about BioBeware because there have been other providers offering, these sort of practicing privileges type model, but you have to make sure that actually, because when I was working with CQC, and it took me about 14 months to get this, CQC approved because there was a lot of back and forth. I think we failed twice, and then we worked with a consultant for 14 months just to make sure that everything was safe, we were able to do everything. And actually, they said to me in the interview, the interview was meant to be like for 3 hours. It was like 6 or 7 hours. They said in 30 years of doing this, they've never seen a service like this. So I don't know what the other companies are offering, but make sure, even if you want to go to somebody else's company, that you have access to all of their policies. You have to also look at their new provider application form to see actually what exactly they can offer. Look at the locations, how they book patients, see GDPR, privacy, terms and conditions, loan working. So all of their policies you need to have access to, or access to some sort of a summary of their policies, because otherwise you're not working under their CQC. You're almost just providing services, and you might not be doing it alongside their regulations. So that's why actually we've taken a long time to do this properly, because we actually want to work with the doctors and allow them this service where they can do what they do best and work on their terms. So yes, the total cost of setting up, I put here, is actually quite modest. Usually if you go it alone, yes, you can set up, I think I put a modest figure of about £30,000, but I've heard people it's taking them to set up a bricks and mortar clinic around 150,000, and that's the average cost of setting up like bricks and mortar, because you have to get the building, you have to pay the lease, you have to pay the business rates, and all of that stuff. CQC registration fee, so that's depending, around 3,000, and that's depending on how many services that you are regulated to provide. Compliance and setup, so that's all your policies, your standard operating procedures, all the templates, all of this stuff that can come to quite a lot. Equipment, insurance. So insurance is the one that will kill you. And I think that's the thing that has stopped people from opening, because the insurance, not just the medical indemnity, because even when I went to open private GP clinics just for myself, my medical indemnity was around £1,200 per month, and that was based on working 24 hours per month or 6 hours per week. So it's actually quite high. And we all know that actually when we start offering services, or when you start a new business or a new clinic, you won't be seeing that many patients, because you're just getting started. You're just kind of feeling your way through, and it's a lot of trial and error. So, to be paying overheads of, £1,200 a month when you're seeing, 5 patients a month, you start to be like, well, let me just forget this and just cut it, because cut your losses. So that's why actually we work with really good medical insurance providers. So that's both the indemnity and also the other business types of medical insurance, which is medical entity, public liability, and cyber security insurance. So we've got all of that sorted, and it costs us a lot, but we've been able to get a really good rate because we've got the numbers, because we have 5,000 GPs on board, and otherwise it would be completely unaffordable. And yeah, you have to do your administration, your booking, your marketing. Like if you're ever doing marketing, like for example on Google, you have to pay the marketers, like the marketing team. their rate of, let's say, minimum starts at about 1,500 a month, and then you have to pay your ad spend on top of that, which is minimum of £1,000 a month. So that's about £2,500 a month just on marketing. And a lot of these clinics, when I spoke to a lot of the other clinic founders, the telehealth platforms, a lot of them, unless you have really deep pockets, like the big names, a lot of them go bust because they literally, the return on investment of spending £2,500 per month, you're not even breaking even. So you're running at a loss, and you can't compete with the big boys out there. So that's why we've actually gotten together, because how we work, we don't advise doing marketing via Google or whatever. We actually work in a referral. So if you're under us with a private clinic, a lot of the private insurance providers have come to us to ask, okay, does your GP do this or do this? And then we're basically into refer, and that's how you get your clients. And plus we have other methods. So in comparison, our one is probably 1,200, and that's for 6 months, and that covers basically everything. You just need to get up and running. So it's a real good sort of cost savings. So we already have cohort 1, and I call them the OGs, the original gangsters, because these are the first people to sign up. They don't really know what they're like stepping into, but you know what? They blew caution to the wind, and they're just going to go for it. So in terms of our private clinic doctors, I think it's about 14 or 15. I was actually meant to stop at 5, and then there's more, and then there's more, and then I was just like, no, okay, we need to draw the line somewhere. So I think I've stopped at 15, and I've deactivated the link, I think. So I'm in the middle of interviewing everybody. So I'm just at the end. I have the last 2 or 3 doctors to interview today after this webinar. But actually, the clinics, they're so good. Like when I'm interviewing them, I'm just blown away with, number one, their background of knowledge, just like their passion, like to help, just their ideas. It's just literally insane. I can't wait to just bring them on this webinar so you can meet them and hear what they're about. So we have clinics in, for example, ADHD, so assessment and diagnostics and management of ADHD and autism. We've got testosterone replacement therapy, doctors doing sort of general private GP services, because we've got really good links to other sort of basically private insurance providers. A GP that's opening in menopause and aesthetics and skin and menopause, acupuncture and yoga. I think this is just so mind-blowing. When I was hearing her ideas, I was just like, whoa, this is, I don't know why you can't really prescribe this on the NHS or have this as a management, but it's really excellent, and the results are phenomenal. A GP that's doing mole checks and skin mapping, because that's a private service. You don't really get that on the NHS. So that's really, really niche, but I know that would do so well and be so popular. Menopause and women's health, longevity, functional medicine, weight loss. A GP who's actually, she's so good. She's really excellent. I can't wait for her to come on and talk to you all. She's doing holistic obesity care, where she's focusing on psychology and behavior change. And it is just, it's things you don't learn in med school. And someone doing sort of concierge medicine and really sort of bespoke treatments for that patient, concierge and preventative medicine. So the GPs will probably be on sometime in the next 2 weeks. I think the next session we're going to just have them on and talk about their experience and how they're doing on their journey of opening their private clinics under us. So they're the original, the cohort number 1. They're the OG. So we'll see how they get on. So I am going to stop sharing. Is it questions at this point? Okay, let me just quickly run through the Uber Doctor so I don't have to put my presentation up anymore. So the Uber Doctors platform is app.bankstock.co.uk. You can sign up now and start putting your compliance. So you can basically say, hey, join as a doctor, or you can sign in. So people have actually started signing in. Make sure that you tick the areas of interest, not areas of interest, areas of expertise or within your scope of practice. So people that already prescribe for weight loss or are very comfortable prescribing for weight loss or minor surgery, please tick the boxes, because that's how you will be sent these job requests, because you have that expertise. So if you don't tick them, you won't be sent jobs in that area or patients in that area that have that need. Make sure also you fill out your location, and there's always a button that you can update your location you are, because for the face-to-face clinics, that's how people will know that you're in that area. So you won't be, for example, in Scotland and you're getting referred a patient in, I don't know, London. So yeah, your compliance documents, I'm really sorry, there's about 22 compliance documents, but it's all very, very necessary. So start uploading your compliance documents if possible. It will take some time. And this is like a tip, because this is what the business sees when they're requesting a doctor. So they will actually request a doctor, and sometimes they'll request someone they previously worked with. So actually, you've got first mover advantage if you sign up quickly, because when the requests start coming in, and you see that patient, or you see that patient for that pharmacy, for example, or for that laboratory, and you explain the blood test to the patients. The patients will usually say to the pharmacist, "Oh yeah, that was really good experience." The pharmacist would then always go to you first, because they'll always say, "Okay, I want to send out this job request for Dr. A because I previously worked with him." So sign up as soon as you can, get your compliance documents on, and then you can start receiving requests, because you've got first read of advantage. You tend to get more of the requests because people know you, they trust you, they like you, you've had good reviews from their previous the previous patients. Here you can see that we pay upon booking, so we don't want these issues. Because I've had issues where people are working for companies and they're not being paid, and I just thought it's insane. Like, how can you work and not be paid? It's crazy. So actually, you get payment upon the booking, and the payment goes straight to you. So there's nothing about chasing invoices or any of that rubbish. I can't believe that's happening. So this is, the doctors. We kind of it's all via WhatsApp. We were going to build an app, but actually people have app fatigue. Nobody wants to use another app. So actually all the requests come from our come through via your WhatsApp. So actually it's good if you don't want it, then obviously you can mute notifications, or you can just there's a little toggle here that you can toggle to unavailable, and then you won't get any requests coming through to you. So yes, this is us. You can find us, so up on board on app.planks.co.uk. You can email us, WhatsApp me, call me, everything. So I'm here. So if there are any questions, I can take them now. Otherwise, we will move on to Dr. Sonia, who's a clinical director of psychological consultations, and she basically assesses and diagnoses ADHD, and it's her own clinic. So I'm really excited to bring Sonia on, and it's really interesting in how we met. But anyway, that's a story for another time. So I'm going to stop sharing. I'm not sure if there's any questions. Let me see in the chat. Let me see in the chat. I'm not sure whether. Gosh, my computer is so slow. I'm no longer at my office today. I'm visiting my mum, so I'm at my mum's house, and clearly it's not like fiber optic broadband. So just bear with me whilst I'll. Okay. So where are the? Okay. Yes. Coming through. So where are the in-person clinics based? So the in-person clinics, it just depends on where you want to open. So we basically work with pharmacies, and that's how we can scale, because we have a partnership with the pharmacies, because we can use their clinic location, their consultation rooms in the pharmacy. If you want to open your own private clinic, then you can choose wherever. So you can choose somewhere that's near you. I have a partnership in London, so there's they're sort of CQC, but they're medical rooms, and you can go and you can have them ad hoc. I would always say just pay per hour per patient. So you can pay like £15 per hour if you've got one patient, or if you've got two patients. So you don't need to spend a lot on having like year-long leases and business rates and all of that stuff. So who is your insurance and indemnity provider? So MDU or MDD or MDDUS. What if I say none of the above? So I'm not really revealing my secret source here, because this one actually goes live onto YouTube. But we'll let you know all of that once you sign up on the platform, because it's not a secret on the platform, because it's really important, because it's a good question. It's really important that you know your insurance, because I was having a chat with one of the doctors, and they said, yes, we're working for a company, but and they insure us. And I said, okay, what did they insure you under? And I think they mentioned, oh, I haven't seen their insurance policy. And I'm like, no, you need that insurance policy just in case. Like, how do you know that you're covered for what they say you're covered for? So always read the small print. As we know as doctors, if it's not written down, it's never happened. So it's a really, really good question, and I will send you that information, but it's going to be on when you sign up, you will have to apply to them independently, even though you're covered under us. So they will know, okay, we're insuring Dr. A or Dr. B, and they will quickly do a quick check on you to make sure that you don't have major red flags in your sort of medical career before they insure you. Okay, so can I only opt in for menopause and weight loss consultations? Yes, you can. No other services? Yes, I am BMS registered menopause specialist. What does BMS stand for? I'm not in the menopause world. British Menopause Society. Oh yes, okay. British Menopause Society. Good. Okay. What about opioid prescribing or they're arriving? Not a good question. So we don't prescribe opioids at the moment. They're almost seen as controlled drugs. I kind of thought risky or dodgy. It's not really. It's a very good drug. A lot of the drugs are very good, but because we're so big, we've got so many GPs, we can't focus. So even the way we work is that our prescribing, our so sorry, I think somebody's microphone is on, but I can hear some rustling. There might be some crisp pack or something. It's making me hungry. But just in case, because there's some interference. But I think in terms of opioids, you can prescribe it at a later date. But even if you try to prescribe it on our platform, we can't physically let you prescribe it because we have to make sure that everybody's safe. And there has been some of the telehealth companies have been sort of slapped on the wrist because they're prescribing opioids. They're not having any discussion with the actual NHS GPs, and these patients are overdosing. And there's a case where a patient died because there was just no discussion with the normal GP with opioid prescribing, and it was just a bit of a mess. So we have to make sure that actually we're watertight on some of these controlled medications prescription. Did you say IV drips? Yep, IV drips can be given, and that you're insured to do that under us. And we've actually had a really big actually brand that's come to us, and they work with scanning women, doing these kind of scans, when women are pregnant. God, I think the words just like the words just skipped my brain. So they scan. So, but then they say, okay, when the women like give birth, they want to be able to allow the woman who maybe has lost lots of nutrients and vitamins and they're very depleted, just to give a holistic overview of what the woman needs, and so they're offering them IV drips. So they're actually asking for GPs now who have a specialist interest in women's health to see whether any of them would want to work alongside them. So they'll be actually giving out requests, and actually they want like a group of doctors that can work alongside them regularly. What are the next steps once we have signed up, once paid the 200 deposit, not had any communication or conversation? Syra Bano. Your name sounds very familiar. Are you in the cohort group? Oh my gosh, guys, I'm so sorry. Like you can see, like it's everywhere. I'm having to refund people because I've actually just stopped the membership. But it just depends on once paid the 200 deposit. So okay, Syra, if you just message me on WhatsApp, we've probably got our WhatsApp number. I can't remember it off the top of my head, but it's on our website, thanksdot.co.uk. But just WhatsApp me. I'll double check your payment, and I'll let you in the first cohort, because if you've paid and I've basically just missed it because I'm doing about a billion things, then they let me know, and we'll let you in because we're doing our first talk.
Thank you. I'll message you.
Oh, thank you, Syra. Thank you. If we are able to do video conference for set days, would there be an option to work from Europe? So with the insurance, they say they don't mind where you work from, as long as the patients are located in the UK, in England. Because the issue is that if something happens, you need to be able to, let's say a patient is in front of you and you can see their face drooping and their speech slurring, so basically they're having a stroke. You need to be able to get hold of 999 and follow our normal protocols for emergency, dealing with medical emergencies. So they don't mind where you work, but but they can't have the patient, for example, I don't know, in Barbados, and when you see them having a stroke, you're like, oh, who do I call? Like, what is the number? Like, and then you start panicking and things go wrong. So we don't mind where you work from, as long as the patients are situated here. Can we send it to a specific patient private pharmacy that is regulated? But the way the prescription works, especially with Quincy Health, is actually you prescribe and you send it either to the patient as like a code, like advanced electronic signature. So it's a code, almost like a EPS. So you can send it to the patient by email, and then the code gets put into the platform, and they get it from any pharmacy. So is that what you mean? Otherwise, you can email that prescription to that pharmacy. So that's how we work with the pharmacies. How many patients do your average GP see through ThanksDoc's setup? What is the average monthly income? Good question. So we haven't launched yet. We're launching the private clinics now. So the GPs are just onboarding, and probably a week after that, or 2 weeks, so in 2 weeks' time, then the Uber doctors. So we're literally just waiting for everyone's compliance to start and to be uploaded because we have lots of demand. We want to make sure that their doctors there, because what will be like sort of egg on my face is I say, oh yeah, we've got this great service, and people are requesting GPs, and there's no response on the other side. So I think actually yeah, so we haven't started, so we don't know, but that's a good question. And I'm gonna, once we do sort of a month or 2 months, then we'll start discussing sort of numbers and average income. Risky as per indemnities also. Why can't you risky as per indemnities? That lady said available. I'm not quite sure of that question. No, so it's £200 per month. So 1,200 is for the 6 months. We don't want to lock you in. If you wanted to continue, then it's £200 per month. So actually, I'm gonna make that a bit clearer. So it's £200 per month. That's what you pay for the private clinic setup. But your doctors, are the rates for task preset or yeah, they're preset for Uber doctors. So for example, it's £39 for a 15-minute online consultation. I think it's £129 for a home visit. And we work by keeping, the platform works by keeping 10% of the earnings. So that's how we work. But we're actually going to recheck the rates, because it's funny, because everyone's like, it's too cheap for a home visit. All the actual businesses are like, really? A home visit too cheap? So we'll probably put it up so you guys can earn more. Can I do only remote? Yes, you can do the only remote. Is there profit share per patient? No, not in the private clinic. So whatever you do, like when you set up, you have your own bank account. So whatever the patient spends, it comes through to your bank account, not into our company account. Process of setting up my own private work. Okay, so there are quite a few questions. Is there option just to pay for CQC cover and use the platform if premises? Not that's a good question, Saba. So not option just to pay for CQC, because CQC has granted us this, and they give us clauses like you have to have clinical oversight. So to use the CQC cover, that means you have to also use our terms and conditions, our GDPR, our what's it called, the electronic medical records. So we have oversight. So it's not that you can just pay for the CQC, because then we don't know how you're operating and we don't know what you're doing or things. So that's how we can do this. The issue with the pharmacy is that they have a shoebox room. Yes. We able to collab and get a deal with Members Club? Yes. So you can basically go anywhere. Like, you don't have to be in the pharmacies. Some of these pharmacies, if you see them, oh my gosh, they're like out of this world. There's one called Lips. So I'm in talks with Lips. I can't remember what it's stand for, but they're in Battersea. And their pharmacy looks like a high-end, like if you've ever been to Dubai, like their high-end medical clinics, like everything just looks so amazing. So it doesn't look like these kind of the traditional pharmacies that have, sometimes they have the perfumes and like the handbags and just random stuff there. They're actually very like swanky. But yes, there you can go anywhere. But I think that is it. I don't think I've missed out anybody's questions that I spoke. I still subscribe to Thankstock. I'm really interested in my own private GP. Yes, you can just be on Thankstock for £39 or £29 per month, and you can see everybody. And that just the £29 it basically covers your indemnity to work on Thankstock. Yeah. Also, what is the grey period between succession of your Thankstock work? Okay. So I'm going to hand over to Sonia, and she's done this ADHD clinic. I'm not laughing because it's an ADHD clinic. I'm laughing because of how we met. Sonia,
very interesting story. Very interesting.
So we'll
not for public consumption.
We were both at this really interesting what was it called, like a conference, and we met at a very interesting stand. But I'm not going to tell you guys what type of stand that we met on. But since then, it was like a match made in heaven. And so Sonia does this really amazing service, and I will hand over to her just so that she can give you the lowdown on what she does. So should I stop sharing my screen, Sonia, and you can share
let's
yours?
give it a go.
Yes? Okay.
Okie dokie. Okay. Can you see my screen? Can you see my screen?
So I can see the screen, but not your present, not your present, wait, not your
No.
presentation.
Oh, it's not playing ball. Okay.
Can,
1 second. Let me try once more. Otherwise, we can just use yours, Linda.
yeah.
Okay. Can we see it now?
Yes, if you just maximize it,
Perfect.
we have
Alrighty.
liftoff. Yes.
Aha. Okay. So I'm Sonia. I'm the clinical director of psychological consultations, and we do the assessment and diagnosis of ADHD, but we also assess autism and dyslexia. So it's not just ADHD, but I'll be talking about ADHD today. So a little bit about me. I'm a clinical psychologist by background. I've done a lot of service development work um, in various NHS trusts and private work too. And I kind of led me to this, to ADHD, autism, and dyslexia assessments privately. So we have a team. We have psychiatry, occupational therapy, speech and language therapists, and obviously clinical psychologists. And we're all very highly trained and expert witnesses for UK courts. So we don't have any junior members really. Everybody is very experienced, and a lot of us worked together in the past. And that's kind of what we do as a team. So with autism, a lot of the assessments need to be multidisciplinary, not so much with ADHD. So with ADHD, it's usually a psychiatrist or a psychologist who will be making the diagnosis. So prevalence, 2.6 million people in the UK, and incidence hovers from 2.5 to 5% according to age. To be honest, I'm not sure these numbers are actually accurate. A lot of what's happened over the years is that ADHD has been missed. So a lot of children have gone all the way through schooling and they've been missed, and now they're seeking diagnosis as adults, particularly women. The diagnostic criteria is very much skewed towards your typical young boy who's hyperactive and climbing the walls. So yeah, there's a lot that's been missing there in terms of people that have just slipped under the net. Um, as you'll probably know, on the NHS, it's a really long wait, up to 10 years in some cases. Children, for example, that are on waiting lists become adults by the time they actually come to having an assessment, and then they're moved on to another waiting list. So it's quite messy right now. And there's a lot out there at the moment about ADHD. As you'll be able to tell, TikTok and Instagram, not all of the information is accurate, as you can imagine. And that's leading to a lot of people kind of self-diagnosing, which doesn't isn't the best way to do it, as you'll know. So let's talk about the science of ADHD. So it's a neurodevelopmental condition. So that means we have to have seen traits present in childhood. It can't just be something that's, present in adulthood. And the main differences are in executive function, so the frontal lobe, controlling behavior. So the main three areas, I would say, just to kind of summarize it, is memory, attention, and self-regulation. So that will affect organization, planning, regulating emotions, which is another area, paying attention and focus, and working memory. So working memory would be things like, trying to hold a phone number in your mind. So in terms of heritability, it's very high. So 77 to 88%. So we will see people that have children that are being assessed, and then all of a sudden the parents are saying, "Oh, I think I have ADHD too." It's not always the case, but as you can tell, the heritability is really high. So costs, so a huge economic impact, 17 billion annually, according to the FT. A lot of undiagnosed ADHD can be misdiagnosed as anxiety, depression. It can be associated with things like substance use, for example, if you think about impulsivity, and there are lots of co-occurring conditions and comorbidities when it comes to ADHD. There's obviously financial implications if there are things like hyperactivity and impulsivity, and inattention, so missing deadlines, leading to fines. And a lot of people refer to this as ADHD tax. There's a reduced life expectancy and high numbers in the criminal justice system too. So, what does it feel like to have ADHD? There are many, many traits, but the main ones that you will see again and again is things like time blindness. So that's referring to not really having an idea of, let's say, how long 15 minutes is, or how long half an hour is. So a lot of this is attentional as well. So it will be kind of losing track of time, getting distracted, not being able to get ready on time, for example. There's a lot of overwhelm when it comes to planning and organization, as you can link back to basically the way that the brain is wired. And there's lots around procrastination, difficulties with deadlines that are very far ahead. The one thing that is really beneficial here is adrenaline, actually, when it comes to ADHD brain. So if you have a short deadline and literally you have to hand something in the next morning or the next few hours, you will find that people with ADHD really thrive on that sort of environment. But there are lots of creative things you can do in terms of strategies to help someone who's been diagnosed with ADHD. And I'll talk a little bit more about that later. There's a lot of creativity and a lot of quick thinking, which is obviously great for entrepreneurs and people that are leaders and make bold decisions. Okay, so I would recommend you watch this little one. If you're interested in child ADHD in particular, there's a little video on YouTube called What is ADHD? And it really gives you an idea of what it would feel like to have ADHD. And when you're listening to patients, it's useful to pick up on these things that children might be describing, for example, or parents might describe their child being as. So, types of diagnoses. So there are 3 different types of diagnoses. One is hyperactive and impulsive presentation. That's extremely rare. Literally out of hundreds, I've diagnosed that maybe a handful of times. It's really quite rare. The second one is inattentive presentation. That's quite common, particularly in women and girls. So you won't see so much of the hyperactivity and impulsivity. You'll see the inattention as the main, the predominant part of the diagnostic criteria that's been ticked off. A combined presentation is both hyperactive, impulsive, and inattention being ticked off on the criteria. So it's a combination of all, and that's the most common diagnoses that's usually given out. So the reason why it's so technical and let's say complicated is there are so many different associated conditions that can mimic ADHD symptoms. So, for example, if you look at anxiety, difficulties with attention can also exist in anxious patients. So patients that are worrying a lot, they're more distracted. They might find it difficult to meet deadlines. They might find it difficult to focus, and also they might procrastinate because they're worried about something. So you really do have to dig down into the presentation and figure out what's going on. Depression as well, that can obviously affect attention. Eating disorders again, and things like diabetes, where you've got sugar spikes and lows, that sort of thing can really affect presentation as well. So it's, again, tracking it back, it's really important that you figure out whether it's a neurodevelopmental condition. It's something that's developed over time from childhood to adulthood if you're assessing an adult. Other things that you need to look out for are things like AU-ADHD. So this is the new kind of term that's been branded about. Effectively, you're saying that somebody has autism and ADHD and meets criteria for both. This presentation, we're seeing a lot in kind of women in particular that are coming as late to the party. They've not been diagnosed as children. They've kind of flown under the radar. They've been very perfectionistic, and they've gotten through education and high-flying careers, and then they're coming back in after around the age of menopause, actually perimenopause. I won't kind of go off on a tangent about this, but I really, really easily could. So you need to be really careful when you're making diagnoses. Symptoms of autism can also mimic symptoms of ADHD if you're not too sure what you're doing. So, for example, a symptom of autism might be making socially inappropriate comments. So somebody with autism might make socially inappropriate comments because they're not aware that it's offensive to the person that they're saying it to. So why is that lady so whatever? Someone with ADHD might do exactly the same thing, but it's the impulsivity. So it's literally, it came into my brain, it came out of my mouth, and I offended someone. So it's a different pathway. So making differential diagnoses is really, really important. Cannot stress that enough. That's why this process is quite complicated when it comes to assessment. Sleep, again, obviously affects attention. So any sleep disorders need to be ruled out. But often people with ADHD also have difficulty getting to sleep. Friendships, so kind of personality disorder type presentations can sometimes mimic what happens a lot in ADHD. Again, I won't go into that too much. Apparently I have 10 minutes, so I will carry on. Trauma obviously affects attention, and there are other associated neurodevelopmental conditions like DCD, dyslexia, dyscalculia that would affect somebody's presentation. So what happens is when someone comes to us, we have a pre-assessment stage where we take information from informants. So that might be a parent, a sibling, colleague, friend, somebody who's known the person for a long time or since childhood, or if it's the child, somebody that knows the child quite well, might be a teacher. We use the ACE Plus, or the DIVA. So there are various types of structured assessments you can use. It's normally about 2 hours that we spend. Mainly it's looking at obviously ADHD traits, and I know a lot of places do it in 90 minutes, but we look at all the extra bits that I've just spoken about in terms of comorbidity. We then have a stage where we will consider whether something called a QB test is required. I have mixed opinions on the QB test, mainly because for this AU ADHD condition, it's not very good, and it can give you skewed results, but we do consider whether we need to do that. We often don't, because our assessments are super comprehensive. Then we have an online feedback meeting where we give a diagnosis or we don't, and we make recommendations. So for an adult, we'll make recommendations for work. For a child, we'll make recommendations for school, and also how to manage ADHD symptoms at home. And the final step is a report is delivered. That's a lifelong report that the person will then have, which they are then protected under the law. So there's something called the Equalities Act 2010, and under that law, schools and education facilities and employers have to make what we call reasonable adjustments. So essentially changing the working environment to help the person with ADHD have a sort of level playing field. So our recommendations, often if somebody has a diagnosis, will be around what I just discussed, but also obviously medication. So there's a titration process that everybody undergoes, and then there are things like shared care agreements that would go to GPs that the person is seeing. There's also behavioral strategies, so sitting down with a psychologist or an ADHD coach and looking at strategies that would help the person focus, for example, if it's inattention, or manage their hyperactivity or impulsivity. There's so many different strategies that can be used. So this is what we do, and we have some post-diagnostic support as well in terms of explaining the diagnosis and accepting it. If you want to refer to us, we'd be happy to take any referrals. We have an email address that you could just use, or you could give us a call. The team is always happy to answer any inquiries, or you can contact me directly through Linda if you'd like. We also can book full assessments on the actual website, so there's the link for the website. And thank you for your time. Happy to answer any questions. Linda?
Thank you for that, Sonia. It was so informative, and I think I basically have. I'm going to refer myself to you because I think with your presentation, I've diagnosed myself with ADHD.
We'll talk about that later.
No, that's another webinar.
Yeah.
Gosh.
A live diagnosis, live assessment. Definitely.
I was like, but do you find that these traits are sort of found in like medics quite a lot? Because I think we're quite like, work on adrenaline. There's a lot of deadlines. Do you find that actually certain cohorts of, I don't know.
Yeah, hugely.
Yeah. Yeah.
Yeah. Paramedics as well. Paramedic,
Oh, really?
working under pressure. Yeah, there's so many different cohorts. I could say that about autism
Gosh.
as well. So many different cohorts, but yeah,
Yeah.
certain jobs are suited to neurodivergent individuals for sure.
Super interesting. Okay, so there's
No
some
worries.
questions that are coming up in the chat. I'm not sure whether you have.
Sure.
Oh, I think actually you're still sharing your screen, so you can
Oh,
stop
am
sharing
I?
because
Stop
I
sharing.
can see like myself and myself.
Ah. Oh
Like what's
no.
going on?
Okay,
Okay,
okay.
brilliant,
Let's do
brilliant.
that.
So, can you see the meeting chat?
Yes.
But someone says, is there a restriction on who can diagnose ADHD in the UK? Sometimes patients bring overseas reports. Not sure if we can accept that.
Yeah, we've had this too. I mean, we've had some really bizarre reports where literally a screening questionnaire has been done with children, and then they've said go to the UK and get medication. That is not valid in the UK. So it has to be completed by a clinician who does a full assessment, not a screen, so not a Conners questionnaire or something. A full assessment where it's all laid out and evidenced, and then you can access medication. So yeah, be really, really careful if you have people coming from overseas and it's not an appropriate clinician who's done the actual assessment, or the assessment itself is not robust enough.
Mhm, mhm,
Yeah.
mhm. And out of interest, when you say robust enough, is there certain things that need to be there before you can say yes, this is a robust diagnosis or assessment?
Yeah, so with the DSM criteria, there are really obvious things. So, for example, with ADHD and with autism, the traits must exist in different settings. So, two or more settings. So, if you have someone who only presents with ADHD traits when they're at home, that's not enough. That's not good enough.
Hmm.
Other conditions have to be ruled out. So intellectual disability is an obvious one. Lots of other things like anxiety, trauma, etc. A lot of the things that I was discussing before. So it's quite an intricate process, and it
Hmm.
really should be done properly. I mean, out of everything that I can diagnose, ADHD is the most difficult, hands down, because it overlaps or can mimic so many different things.
Okay,
So yeah.
I'm gonna be selfish and just ask one more question because it's like
Sure.
so interested in this. How long does this process take, or how long on average does it take you to diagnose? So if we send a patient to you and they say, okay, how long will it take? What's it like? What is the patient journey?
Yeah. So once you refer someone, what we do is we actually have we don't have a waiting list, so we see them straight away. So it would literally be within 3 working days we would get them booked in. The only thing that delays the process is the pre-assessment information usually. So it's informants filling out questionnaires, admin stuff, or schools when it comes to children being assessed. But we have done it in literally a week from start to end. So we're super quick.
Fantastic.
We are the quickest on the market for sure.
Yes, love
Yeah,
that. Love that. Okay. What's the waiting times for patient assessment? I guess that
there's
one's
no
been
waiting
answered.
time.
I guess that's been answered. So it's not like the NHS, like 10 years, or like
Oh God, no.
some like 30 years.
Yeah,
I've seen
yeah,
some horrendous waiting lists. Okay. Okay,
it's
so no
pretty
waiting
bad right
times.
now.
What tips do you have for differentiating yourself with other providers?
Apart from us being, having not having a waiting list, and to be honest, most providers now do have waiting lists. We actually have a really high caliber team, and I'm not saying that. I mean, personally, as a clinical director, I'm a little bit of a snob when it comes to picking clinicians. I have to be honest. I will have to drop this at some point, but all of our team are expert witnesses, so they write reports for courts, and they're very, very thorough. So if you want a comprehensive, robust report, come to us. That's what you're going to get. And we've been told that it's the most comprehensive report various people have seen. So Senkos and things like that.
Excellent. What are the charges for assessment?
So for ADHD, we charge £1,500, and that is everything kind of included, including the final lifelong report. They can split the payment into 3 installments. So we would take 3 payments of £500, and that can be spread out according to whatever the person needs to do. So if they need to spread out their appointments, by weeks or months, they can. So it's flexible in that sense.
Hmm. I'm just wondering, off the top of your head, is there funding to? So I know even when I went for my dyslexia assessment, there was almost like funding by the uni that would fund the assessment. Does that happen with like ADHD as well?
So with ADHD, it's a little bit complicated because they keep changing things. So with ADHD, there is right to choose. So a right to choose is a scheme, but there's lots of question marks about it going to consultation and being changed and things like that. It's only certain providers that will do it. What you need to look out for is when it comes to right to choose, yes, you're not paying for the assessment, but if you're having a child assessed, most of the providers I've heard of just do it online, and you can't really assess children online, the young ones. You need to look at hyperactivity, that can look like hypermobility sometimes. You have a hypermobile child that just keeps squirming around. They're not hyperactive, they're just uncomfortable. So you really have to see children face to face. That's my opinion anyway.
Okay.
Yeah.
Okay. So what the charges? Can you see older teens, e.g., 17, or only adults?
No, we see children from 6 for ADHD, 6+, right the way through. We've assessed someone in their late 60s. So yeah, teens are included in that for sure.
If you have your hand up, just shout out, please.
Hi.
Hi.
This is for Sonia.
Yep.
Can you hear me?
Yeah, I can hear you fine. Yeah. Go for it.
Is psychological consultations? Is your team hiring psychiatrists for assessment?
Yeah, we really need more psychiatrists. We have people that we collaborate with that we're just sending a whole load of referrals to that we don't need to be doing. So yes, we are looking at psychiatrists, and obviously there'll be child and adolescent, and there'll be adults. So yeah.
So how do we make contact? How does one make contact with your team, the recruitment team?
With the team, so you can literally just send an email, and we will that will get through to me, and then we can have a chat. So,
okay. Yeah. Thank you.
No worries.
Do you have a LinkedIn that people connect, or is email better for you?
No, you can come through LinkedIn if you want to. I'm on LinkedIn. Yeah. Yep. So I think it's just Dr. Sonia Malik, or if you put psychological consultations, it will link back to me as well. So LinkedIn is fine too.
Okay.
And otherwise, what is the email address? Is there any particular email address that?
Yeah, I'll just put it in the chat actually.
Thank you.
No worries. And if you want to send referrals, you can also send it through here. But we do have a team that's happy to take calls as well. So it's in the group chat now.
And yours assessment are all face-to-face, right? They are not online ones.
No. For adults, we can see them online. It's absolutely fine. We don't do that with young children, but we will do it with the late teens, so 15, 16, 17 onwards.
And how is it set up? Because I came with I think different understanding that this was about independent practitioner registering with Thanks Doc, but it is only for GPs, it seems, as Linda answered. But I don't have a CQC registration, so is it that you require me to have CQC registration, or I am contracted with your company?
No, it would be so the model that we use, we have people that will be self-employed. It depends on what you're working on, but you could just come as somebody who's self-employed, has their own indemnity, etc., and you literally invoice us whenever you do an assessment.
Thank you.
Fantastic. Does one need to be seen face to face? Okay, we've answered that. So yeah, for pharmacological management, how do you manage them? Do you just refer them on, or what happens there?
At the moment, we're referring them on to trusted partners that we have that we're collaborating. The companies are collaborating quite closely on other things. So yeah, and that's what we're doing right now until we get more psychiatrists on board as well.
Fantastic. And I think that's all the questions. Especially since diagnosed slowly. Yeah, I'm not familiar with a private GP ADHD clinic setup. Is it a GP with specialist interest who diagnose only?
So Yeah, I mean, often it's psychiatrists or psychologists that do specialist training on top of their usual training to do ADHD assessments. I'm not super clued up on whether GPs can do the same sort of training and start doing that. I mean, as you can see, there's so many mental health conditions that you need to rule out, so you would have to be pretty savvy with
Mhm.
mental health, to be fair. But I've heard of other professionals as well doing the training. Any information on RTC contract with NHS? We're just private at the moment. We are looking at RTC, but we are right now we are just private. So RTC is right to choose. But
Yes.
right to choose is being, yeah. We'll see
Road-
what happens
road
to right
traffic.
to choose.
Road traffic collisions. That's what I was thinking. That's where it's going. Oh my goodness, we're having one of our moments. Okay, and someone has asked, what advice do you have for ADHD assessments done by private GPs, ADHD clinics? Do you accept referral from them?
Yeah, absolutely. Well, they accept referrals for from any GP and to be honest, we don't really need a referral. You can literally just send the patient across to us and we're happy to take it from there. There's nothing that GPs need to do in particular. So yeah, it's open to anyone that wants to look at an assessment. Yeah, for the private assessment.
Fab. I think that's
Just-
it.
just
Thank you
to-
so
just to-
much. Oh yes, go.
Oh,
Hi, sorry, my bad. Just a quick question. In the NHS, if there's a diagnosis been made, there's often a shared care agreement. So does the same apply with the private setups?
Yep. So what happens is after diagnosis, you would go for titration. Once you're on a specific dose that you're happy with, then it goes to shared care agreement. So that would be the consultant psychiatrist writing a shared care agreement, writing to the GP, and then GP prescribes. So it kind of goes that way. Regionally, there's some practices might not accept that. Honestly, it's completely random. There is no rhyme or reason to any of it.
The reason why I say that, because I work in the private sector predominantly, but I get lots of patients who've had the diagnosis done from whichever body.
Yeah.
And what I'm rather perplexed that why the referring clinician, i.e. the psychiatrist, can't prescribe. So they end up coming to us, asking us to prescribe, and I just refuse because I'm like, I actually haven't done the assessment. So I'd rather stay.
Yeah.
So this is something I'm just worried about if this is going to happen as well.
So often it's because they don't want to. It's not because the psychiatrist can't prescribe. It's because of the cost.
Yeah.
So
okay.
it's a cost thing. Yeah, it's just a cost.
All right. No worries. Thanks so much. It's awesome.
No worries. No worries.
Fab. So I think that's it. I think we finished kind of on time actually. I'm
Amazing.
very impressed because usually it's like 1 hour, 45 minutes and people are dropping off. But that was really, really informative. And it gave me sort of a good understanding of ADHD and sort of even what to look out for and how to refer and, almost support them through their journey of like assessment, screening. And that's really good that you have this fantastic service, Sonia, that is actually helping so many people, because I think we were having a chat about it where you said actually people that are diagnosed as adults, sometimes there are reasonable adjustments that their workplace need to make for them to, operate, as normal.
Yeah.
So what sort of, because you sort of, could you talk a little bit about that as well?
Yeah, sure. Under the Equalities Act, so you have a legal right, once you have a diagnosis of autism, ADHD, etc., you have a legal right to reasonable adjustments. So that might mean things like flexible working. It might mean if you have sensory sensitivities, having access to shorter meetings, not busy places, all sorts of, there's so many things that can be done. We do also offer occupational health assessments for companies that are legally bound to make these adjustments but just don't know what to do, and to be honest, it's very individual. We will see people that have a diagnosis, but it might not, one person won't be the same as the next person in terms of what they need for work adjustments. So yeah,
Fantastic.
there is a legal requirement there.
There is.
So,
so, and as
serious.
part of your assessment, do you also advise them of sort of the things that they can have, legally?
So the occupational health assessments will have a whole list of recommendations. We would meet with the person managing that individual. We would discuss all the reasonable adjustments that need to be made. We obviously interview the person with the diagnosis as well. So it's a whole process that we go through, and we're very specific about what to what to actually do in terms of reasonable adjustments.
Fantastic. Thank you so much for your time. I really appreciate you being here and sharing your knowledge and also the knowledge of your service. So I'm sure that, number one, I'm going to be first referral coming through. But oh my gosh, like,
Pro bono,
it makes so much sense.
too easy.
Oh, it's amazing. Honestly. So thank you guys for joining us. We're going to have another webinar, but we've got Sonia's LinkedIn profile link there somewhere, and also her like her email address. So any issues or any concerns? Oh, yeah. I think we've got one person wanted to ask another question before we head off.
Yeah, go for it.
No? Okay.
No.
There is one. Okay, so I'm going to stop this webinar because it's now an hour and 15 minutes. And I will see everyone on the other side for our next webinar. And Sonia, I'll catch up with you in a bit.
No worries.
Well done. Thank you so much.
See you
Appreciate you.
soon. Cheers.
Bye.
Thank you.
Thanks, everyone.
Bye.
Bye.
Thank you. Bye.